Everybody all set then? Okay. Well, good morning, ladies and gentlemen, and thank you very much for coming out today. I'm delighted to be joined by Rick Leary, the Chief Executive Officer of the TTC, and while we're dealing with a serious matter this morning, I should tell you that I had the first experience I've had on riding on the public transit with Rick Leary this morning, and people often greet me on the platforms when they see me on public transit, which I use often, and come up and talk to me about various things, including the service on the TTC and different observations they have. Today, we were both wearing masks, and a number of people came up to speak to me about that, and I resisted the temptation to introduce the man standing beside me, because I thought it would have been an easy handoff for me to give him those things, but next time you won't be so lucky. I'll make sure they know. But we are here to talk about something that is a serious matter. I think it is something that people have come to expect that we're going to announce, and I think it is a significant step forward for us in containing the spread of COVID-19 and making sure people feel confident and safe on the TTC. And that is the fact that Rick Leary and Dr. Eileen de Villa are recommending that face coverings be made mandatory on the TTC. And that is a recommendation that I fully support, the making of face coverings mandatory on the TTC. This will help to stop the spread of COVID-19 in our city. As the restart and reopening begins, we know that there will be more people back on the TTC. We want more people back on the TTC. But at the same time, physical distancing will become a greater and greater challenge. Mr. Leary has been very upfront about that, as have I. Dr. de Villa's advice has been clear, that if you can't easily keep your distance, then wear a mask or a face covering. It helps to stop you from spreading your germs to other people, which in turn, of course, helps to stop the spread of the COVID-19 virus. We are doing everything we can to make sure that the TTC remains clean and reliable and safe. We've made sure the TTC has the resources to do that, and Mr. Leary has been doing an excellent job with his entire team all through the TTC to make sure these things are done. That is why we've increased cleaning, significantly increased cleaning on the TTC system itself in the stations. It's why we've kept service going throughout the pandemic, despite a dramatic drop in ridership, and it is why we are continuing to add buses to the busiest bus routes. And that's why today we are giving notice of our move to make face coverings mandatory on the TTC in order to protect the health of everyone who's on the system. And that includes both the staff on the system, but of course, an increasing number, hopefully, of passengers. This recommendation will go to the TTC Commission for its meeting next week. And if approved, face coverings will be mandatory, effective July 2nd. But there's no reason not to start now. We've been strongly recommending for weeks that people should wear face coverings on the TTC. I noticed this morning on the subway that the majority of people in fact were, but not everyone. The majority were, and I think that's a good start that they are already. And I know the remaining riders will get on board with this new mandatory instruction quickly. There will be some exemptions, and I'll let Mr. Leary address those details in a moment. Let me tell you why I'm confident that we will get a good take-up on this, despite the fact that it is not a usual thing for the great majority of us. I really believe that people want to protect their own health and the health of others, and most particularly the health of others. Of course, people want to be healthy themselves, but I think there's a real caring and concern in the Toronto way that we want to do everything we can to protect the health of our fellow citizens. And I think that people in Toronto also, as they've proven over and over again during this pandemic, the vast majority want to do the right thing. And that leads me to conclude that they will, in fact, wear a face covering on the TTC. I know that a crackdown or an enforcement blitz won't be needed. And the TTC is not recommending that either, as has been the decision in most other major cities that have taken this step. Similar to those other cities that have made face coverings mandatory, we will focus on public education and on communicating the importance of following this new rule for the sake of your own health and more particularly for the sake of the health of others. The TTC will employ a one-time targeted strategy to distribute 1 million non-medical masks with a specific focus on neighbourhood improvement areas, some of the areas that are more marginalized and have lower incomes available to them, and that is something to help support access to these face coverings, another move on the part of the TTC that I strongly support. I know many people are apprehensive about riding public transit again. The system is safe. If it wasn't safe, Dr. Davila would have asked us to close the system during the pandemic. If it wasn't safe, Rick Leary and I would not have been riding on that system wearing face coverings this morning. I know in many respects this is still a scary time for people. There are still many unknowns with respect to this virus, and there's still a real concern on the part of people coming out of a very difficult period for all of us. But we are doing everything we can, we meaning the city government, working hand in hand with the TTC to make sure we can tell you that the transit system is safe. Cleaning of stations and vehicles has been dramatically increased. Mr. Leary was pointing some of that out to me this morning. I'm also supportive of increased staffing that will take place in stations and stepped up communications about distancing and about face coverings. And you can see it, as I did again this morning, on the platforms where there are decals there that remind you about a face covering, and there are decals there that remind you about physical distancing on the platform and otherwise. I saw some of those changes happening. But in the end, it comes down to people and their own sense of personal responsibility. First and foremost, I was reminded of this by reading the new transit guidelines published today by the Government of Ontario. It says, and the first thing we have to remember, more so than anything else, even more so than face coverings and physical distancing, is if you are ill or if you have any symptoms, you should be at home, and you shouldn't be riding the transit system, or for that matter, be anywhere else outside of your home. But second, you have to show your responsibility and your concern for others by making sure that you wear a face covering. This is for your good and for the health of other people and the health, indeed, of our entire city. You should wear a face covering on the TTC. Governments can pass all kinds of orders and issue all kinds of rules, but it is always about people in the end and their willingness to consider others. They're willing to consider the greater good of the public that is going to determine whether these kinds of things are successful. And after all, success in this case is going to be about stopping the spread of a virus and being able to allow us to get on with a meaningful reopening and recovery and a return to normal life as soon as possible. That's what success is about here, and that is what requires us to look out for the interests of others by wearing a face covering on the TTC. I want to thank Mr. Leary and our TTC employees for their work throughout this pandemic to keep the transit system running. Our frontline transit workers have made sure that thousands of essential workers in hospitals, in long-term care homes, in grocery stores, in other essential public services got to work and got home safely every single day. The TTC Commission will be also considering, in their meetings next week, and I trust they will be approving, a recommendation to issue refunds to TTC monthly pass holders for March and April based on daily usage or lack of usage. Providing this credit is the right thing to do, and I'm very hopeful the Commission will approve this and refund money to people or refund credit to people who bought a pass and didn't use it. I would now like to, with my immense gratitude for his consistent, steady, balanced leadership, and I've had lots of chance to sit and talk about things with him and make plans for all the different things we're trying to do to keep the transit system going and to make sure we have it running in a way that is as safe as it possibly can be for people going forward. And I just want to thank him for all the hard work and leadership he's shown together with the whole team, and call on our TTC CEO, Rick Leary, to say a few words.
Good morning, everyone. Thank you, Mayor Tory, for having me here today. I much appreciate this. I'm here to talk about the importance of wearing cloth masks or face coverings for customers riding the TTC. In a report to our board being released later this morning, I'm recommending that face coverings be made mandatory on the TTC. This recommendation comes after careful consideration and with the input from our legal staff, as well as in consultation with Toronto's Medical Officer of Health. As you know, the TTC is an integral part of life in the City of Toronto. And like so many other businesses in our great city, this pandemic has challenged us like never before. As offices, restaurants, and live entertainment venues closed, we saw an unprecedented drop in ridership. Almost overnight, we saw a reduction in 85% of our normal volumes. But even with that drop, we continued to move hundreds of thousands of Torontonians daily, connecting them to their essential jobs and services. As the province and the city have started to reopen in a safe, phased, and responsible way, we are seeing our customers return. And we know as that more things reopen, the TTC will be moving more people. We look forward to welcoming everyone back to the TTC, and I want to make sure that people know that our system is safe for both customers and employees. But as we move more towards that recovery, physical distancing is simply not always going to be possible, especially on our bus fleet. In fact, we've already seen bus ridership increase the highest levels since the province and the city declared a state of emergency back in March, and we are redeploying our vehicles to those highest ridership routes. And that's why it's become even more important now than ever to wear a cloth mask or face covering while riding the TTC, and why we are recommending they become mandatory on July 2nd. Mandating wearing of non-medical masks or face coverings is not only a practical public health consideration, it is an important part of the TTC's restart and recovery plan that the board will take into consideration on June 17th. Our policy includes exemptions for children under 2 years of age or people who have medical considerations. We ask that people be aware and remember that not all disabilities and medical conditions that prevent someone from wearing a mask are visible. Similarly, our employees who work behind a shield or in isolated cabs will have the choice to wear a mask or face covering. I want to be clear, no one will be refused a ride on the TTC for not wearing a face covering. Given the exemptions, and based on experiences from other jurisdictions where compliance has been high, like New York City, we don't believe strict enforcement is necessary. We will continue to monitor and determine if further actions are necessary. Safety of our customers and employees is paramount to everything that we do. I have spoken to Dr. Eileen Davila, and she supports this recommendation. And we will continue to work and take the advice of public health officials when it comes to our service. While we cannot provide face coverings for all our customers, we will be employing a one-time targeted strategy to distribute 1 million non-medical masks with a specific focus, as the mayor said, on neighborhood improvement areas. And I'll let the mayor know we're working very collaboratively, and as well as yourselves, with the City of Toronto's poverty reduction offices on this initiative. Of course, face coverings are only just part of what we're doing around safety. We continue to clean and disinfect all our public spaces, our stations, our vehicles, multiple times a day, with a focus on touch and grab points, such as buttons, rails, hand straps, and straps as well. We have floor markings and directional signage, as the mayor mentioned, to help guide people through our subway stations. We have hand sanitizer available in all subway stations, and we're investigating the potential of expanding that to streetcar and buses. We know right now that 50 to 60% of our customers are already wearing face coverings, and I'm confident that a vast majority will opt to follow suit, not only for their own peace of mind, but as a courtesy to others. In order to get the word out, we will undertake an extensive awareness campaign, a public education campaign, throughout our system and via social media to bring attention to this important initiative. I know some of you will ask, well, what has taken us this time and why? That's a fair question, I will say. My simple answer is we are a large, complex system, and we move more people than any other transit system in North America other than New York City and Mexico City. With that comes our social and legal considerations that may be not as complex in other places. However, I am confident that now we have given this matter proper consideration, and we are ready to move forward, and I look forward to our board supporting this proposal on June 17th. With our combined efforts, we will be well positioned for our customers to come back to the TTC in a way that is safe and welcoming for everyone. Thank you very much.
Okay, we will now take questions. Just a reminder, it's one question, one follow-up. TTC CEO Rick Leary will also be available for questions. First up, we have Mark McAllister from City News.
Question to perhaps both of you regarding the education that you want to pursue rather than enforcement. It's one thing to be able to say that, it's another thing to have the number of people that you need to get out onto the system, whether it's enforcement officers or otherwise. But how will you go about doing that and getting people to wear their masks when you do approach them?
Well, I will just tell you from our part, part of what we did, and I will continue to do this, as we started by riding the TTC this morning, wearing our masks, and I will continue to do so. And I think that is one of those things where, if we can set an example. Secondly, we're going to build on a base that's already there. I saw for myself this morning, and Mr. Leary's studies have shown that the majority of people are already wearing face coverings because they think they've heard the medical advice from Dr. Davila in a number of different respects that wearing a face covering protects other people from your germ spreading if you have any. And then finally, we have been very supportive, because we've had many meetings about this over time, of the allocation of additional resources that Mr. Leary will describe to you to make sure that we have increased staffing and others who will help to educate people, in addition to the decals and so on. These are some of the decals that you now see on the back of buses, that you now see on the floor of the platforms, reminding people over and over again of the need and the requirement now after the commission meeting to wear a face covering. So I'm optimistic people are going to get the word, just as they've done with physical distancing. The majority get this word pretty quickly because they know what is in the interests of the public, of other people's health, and they sign on to the program. And I think we start with the majority already doing it. We just have to work our way up to full compliance, which I'm confident we can do.
Thank you, Mr. Mayor. In addition to that, as the Mayor had mentioned, we're going to put significant amounts of staffing in stations. We're going to call them COVID ambassadors. There's over 100 additional staff in stations that'll be helping get the word out and helping passengers and reminding them. They'll be there with the masks as well. So we intend to use those 1 million masks to make sure that we get the message to people in case they haven't heard it.
Follow up?
The last time yes, can you hear me?
Yep.
The last time we had heard about losses, it was $92 million a month. I'm just wondering if you have an update on that and what happens as a result. I know that there's been calls for more money from other levels of government.
So right now, as you're probably well aware, that we initiated a cost containment strategy at the outset of this pandemic. And so we notified everyone that we were losing about $21 million a month, and we've almost half that with our cost containment strategy. And as for future funding, we continue to work with the city and other levels of government to have those discussions about the needs and the importance of public transit in the city, and for those that depend on us every day, as the hundreds of thousands that are out there today are doing.
Okay, next up we have Haley Cooper from News Talk 1010.
Just on that last one, I think Mr. Leary said $21 million a month. He meant $21 million a week. Yeah, that was just because I don't want the other governments who I'm up there asking for money to misunderstand what the magnitude of the losses actually is. $21 million a week. Sorry, go ahead.
Go ahead, Haley.
Okay, thank you. Hi, Mayor Tory. I just want to be clear, are there going to be any penalties that someone could face if they are not wearing a mask on the TTC?
Well, I actually can't answer that question in terms of what's being put in front of the commission. Mr. Leary will answer that, but let's make no mistake. We are not trying to engage in confrontation with or engage, as we said, in big enforcement blitzes on this thing, but rather we're going to focus our efforts on education and on persuasion, using the staff, the COVID ambassadors, using the 1 million masks that we're putting forward. And I think they found in other cities this is a far preferable way to make this happen, as opposed to trying to have some kind of a campaign or some kind of penalties that you're going to be out seeking to impose on people. But maybe you could talk about the precise wording of the proposed bylaw or resolution. I haven't seen it.
Yes, the bylaw permits a $195 fine, but I can tell you that we won't be issuing fines for these infractions. This purely is about educational campaign. We know from a number of the other transportation organizations around the world, and more recently in New York, that 95% of the people right away started wearing masks. So this is about education, not enforcement in that way.
Okay, I'm trying to distinguish between the difference of this being mandatory, where it sounds more like a recommendation if there's not really going to be any action taken against someone who's not wearing a mask.
Well, mandatory is mandatory. And it says in this bylaw that will be put forward and hopefully passed by the commission that the wearing of a mask is mandatory on the TTC. there then does arise, obviously, the question of enforcement. And we're following the practice of other major transit systems in Canada and in the United States of saying we're not going to be out blitzing and enforcing. Does that mean no one will ever be given a ticket? Of course it doesn't. And that's not within the discretion of politicians or chief executive officers anyway. There are enforcement people who will do that. But I think that what we've both indicated quite clearly is this is meant to be understood to be mandatory, compulsory, use whatever word you want. The bylaw will provide for that just as it provides for many other things to be mandatory or prohibited on the TTC, and that we're very hopeful, especially given that it's other people's health that is at risk here, that people will follow along. And Mr. Leary has indicated, and I've certainly been persuaded, that in most other cities, all of them, where they've done this, the results have been more than satisfactory with a mandatory order without enforcement blitzes, and that's the way we'll proceed in the City of Toronto.
Okay, next up we have Ben from the Toronto Star.
I guess I'd just like some clarification here because Mr. Leary just said that we won't be issuing fines for these infractions, but the mayor just said that it's possible that some people will get a ticket. So I think that's an important question, Mr. Mayor, because I think there is concerns that enforcement might be difficult to enforce and might target certain groups and that kind of thing. So will people be fined for this?
You know, I think the problem, and I don't think Mr. Leary would have any easier time answering this question than me, because what you're wanting for me or for him to say is that no one will ever be receiving a fine on this. And, you know, for example, I suppose it's possible that if a person, you know, repeatedly, day after day after day, came to the same station and utterly refused to wear a mask, that somebody could issue them a ticket. But I think we've indicated very clearly that the practice to be followed by the TTC, and I'm sure the instructions that will be given to the employees, including, as Mr. Leary clearly said, that no one will be denied a ride on the TTC because they're not wearing a mask, would indicate that our good faith, very clear intentions are not to enforce this and not to issue fines. But I think, you know, oftentimes it's very difficult for people like us, whether it's a mayor or a TTC CEO or a member of the TTC, to say we will never, ever, in any circumstance whatsoever, issue a ticket. The intention is not to do so. The intention is to educate, persuade, to give out masks and make sure people have access, and to rely on the public to exercise their generosity of spirit, their concern for the public good and public health, to wear masks, as has been the case in every other major city in North America where this was started before we've started it. Do you disagree with that answer? Okay, I want to make sure. You know, it's the best we can do. I'm sorry, you have to try your best on these things to answer the questions, but.
And I have a follow-up question as well. On a different note, there's a motion going to the board next week asking for the TTC to fast-track the implementation of priority bus lanes on 5 busy routes. Do you support that, Mr. Mayor? And I'd also like Mr. Leary to weigh in on that, too.
I will just say that I have repeatedly and consistently indicated my support for the creation of priority bus lanes. The Transportation Department of the city is now working with the TTC, because it came based on a recommendation from them as to places where this would help move passengers on bus lines better. And they're in the midst of figuring out which of the places recommended could work. And so whether we can speed that process up or not, especially considering all the other things the Transportation Department is working on, from curb TO to active TO to patio TO, cafe TO, I think we call it. They're working on a host of things. We will see what we can do. But I've been supportive of it throughout, and we will see whether we can do these things more quickly if it's at all possible.
Yes, and as you're well aware, in December, the TTC brought a recommendation to the board for bus rapidways. We actually have a report coming back to the board in July with what the timeframe and schedule could be. So we welcome this opportunity to expedite in any manner we can bus rapidways in the city to help, you know, bring back customers to take the TTC.
Next up, we have Jenny from the Toronto Sun.
Hi there. So in early March, the ATU 113, they had said that they wanted their operators to wear masks, and the TTC said that they needed to get more info from public health officials. So the TTC ended up changing its position as of mid-March. And so in May, early May, the union once again said, we want passengers to start wearing masks, and the TTC said, well, we're going to be doing that as of yet, and today you're making that announcement. Do you think that the TTC and the city have fallen a little bit behind in terms of implementing these protocols?
I will speak as mayor and say not at all, because you asked about both the city and the TTC. And the reason I say that is twofold. First, we have sought and received the advice of the medical officer of health, I think almost every day, on the subject of face coverings and masks since the pandemic began, whether it related to the TTC or elsewhere in the city. There's no topic that has been discussed more frequently with the medical officer of health than this one. And we have relied on her advice and when she said certain things should or should not happen entirely in this regard. And had she ever said at any point in time that the wearing of face coverings should be made mandatory on the TTC or anywhere else, that we would have the authority to so require, we would have moved in that direction, because I can tell you without exception that I have followed in everything that I've done in this pandemic her advice, and excellent advice it has been. But the second thing, and Mr. Leary can elaborate on this, up until now, the levels of passenger traffic on the TTC were such that we could basically guarantee people the first thing that Dr. Davila and other health professionals would say is the most effective way to prevent the spread of the virus, which is physical distancing. People could sit on a bus or subway car or streetcar 6 feet apart because the traffic levels were so light. But as those have come up and have been steadily rising up, especially on buses, it became necessary for us to do this daily reconsideration of what we did. And in fairly quick order, as the traffic started to move up to levels approaching the level at which we can't guarantee physical distancing, we acted. And this recommendation is going to the Commission next week.
I'd also let you know we work very closely with our unions when it comes to making these decisions, in addition to talking to Toronto Public Health. And we have to remember that when we made that decision to allow them to wear masks, it was purely for their own comfort. And at this time, even with the recommendation making it mandatory, knowing they have a barrier and they're distanced from our customers, we're continuing to make it optional for the operator for that reason, making sure it's their comfort as they drive the bus, because the safety of them, of the operators, is just as important as our customers, but the movement of the vehicles is also critical, and we want them to be very comfortable in doing that.
Jenny, do you have a follow-up?
Yes, I do. I'm just wondering if the TTC is worried about extra passenger assist alarms that are bound to happen, especially once it gets colder and you turn up the heat in subways, for instance, and there might be trouble breathing with these masks on, because as you know, we're walking around in the summertime, it's often hard to have these masks on. Have you considered any sort of like maybe turning down the heat as a way to sort of balance that out?
So I can tell you that part of our plan, as I mentioned earlier, when it comes to having staffing in stations, it's that emergency response, the quick response that's necessary. In addition, we'll have additional vehicles, trains, strategically placed around the system so that we can keep the flow of our passengers. We're thinking about those type of items all the time on a regular basis, not just with the pandemic.
Okay, next up we have Christina from CP24.
Hi, Mayor. Hi, Rick. Wondering if this is something you anticipate will be in effect for the long term. What's the timeline for the masks being mandatory after July the 2nd?
Well, given what I said earlier, namely that we have followed the advice of our medical officer of health and the professional health advice in what we do with regard to face coverings on transit, I would think that the same will hold true of a day that may come, hopefully sooner than later. Because look, as somebody who has taken to wearing these masks quite frequently, it is something you start to get used to, but I don't think it's ever been something that we ever thought we would end up doing in Toronto, even though in other parts of the world, for different reasons, sometimes related to air pollution, they've done it for a long time. So we will rely on the advice of our medical officer of health. We will see what happens with the health situation here in terms of COVID-19 and make decisions, accordingly. I'm sure this will continue to be one of those topics, just as it has been in the past, that gets very, very frequent consideration, because I know people's preference would probably be not to wear one of these masks if they had a choice. I know that would be my preference, and I think that's true of many passengers. So it'll be considered on an ongoing basis, and it'll be considered based on professional health advice from objective people like our medical officer of health.
And the masks the 1 million masks that will be distributed to various communities, I imagine those are, reusable cloth masks. And just on that note, why not have, TTC and bus and streetcar operators and even the TTC associates who work in the subway vestibules have some on hand? Would that not then assist with, someone who shows up without a mask if you're going to head 1 million of them anyhow?
Well, that's exactly what we're going to do with those masks, and they're not reusable masks. We had 1 million in inventory that are the one-time use, and that's why we say we can't give everybody a mask, but we can strategically around the system make sure we do it as a means of reminding people the importance of masks, and that they can get that the thought going forward. We are actually going to look to see where we can find people to come in and actually sell masks on property potentially. We're looking at all avenues right now to get the word out on masks.
Okay, next up we have Julie Ann from Radio Canada. Julia, go ahead. Okay, we will go to the next person, which is Linda from CBC, and we'll come back to Julianne. Linda, go ahead.
Hi there. I was just wondering if you could elaborate a little bit on the ad campaign and the communication, how this is going to be communicated across the system, and if it will be communicated in different languages.
It's a good question. Yes, it will be in multiple languages. They're looking at that right now. The campaign's really going to focus on making people aware of the different means, whether it's a face mask, using a bandana, using a neck wrap. It's going to really focus on making sure that anybody coming on the TTC and outside the TTC, mind you as well, we want to make sure those that potentially can use the TTC and become a future customer are well aware of the safety efforts that we're placing. We will focus on the washing of hands and the coughing etiquette, obviously, but it really is going to be the whole concept of the mask and the safety initiatives going on, all the cleaning, the touch points that I've gone over. I like to remind people that it was the TTC, in Canada and much of North America, that in mid-January actually took the first initiative to doing the significant cleaning and disinfecting of our buses and stations. So we're very proud of that, and we're going to keep that moving, and that's the message we want to get out.
Thank you. And just as a follow-up.
Can I just add to that, just on that very question, though? I think if you look at even the beginnings of the communication effort, it shows something that I think is very important to note in the context of the accessibility of face coverings, and it's one of the reasons we use that expression to people. And I saw this morning on the TTC quite a few people who were using face coverings, which would be something they would have readily available to them at home already, namely a scarf, properly worn. And one of the reasons why the graphics you see behind me indicates that there is a way to wear something like that doesn't require people to go out and purchase something they may already have, is so that people understand that is an option that can protect others from the spread of their germs as effectively as something that you might buy. But as Mr. Leary said, we're going to give away some initial masks, and we're going to explore, as we've been discussing, the sale of some masks by potentially in a partnership, as they've done, say, in Ottawa, to people so that they can be accessible to them. You had another
Thank you.
question.
Yeah, just in terms of physical distancing, we know the province is encouraging that still in their guidance. Will that be possible on TTC vehicles as they do become more crowded?
Well, look, I'll start on that because I read the provincial guidelines this morning and I circled a sentence. I brought it up with me, but I'm not going to start fumbling with my papers now to read you the sentence. But it indicated, as would obviously be the case in any instance, that yes, physical distancing is by far the most effective way to make sure you stop the spread of this virus, but that it's also recognized in the provincial guidelines, as we have recognized in a very transparent and candid way, Mr. Leary has, I have, that as more and more people return to the TTC, as we hope they will, it won't always be possible to guarantee that kind of physical distancing. And so as a result, it's one of the reasons why the public health advice has again consistently been, where you can't be guaranteed of physical distancing, then you should wear a face covering. And so that is why we moved, as we approach levels of ridership on some bus routes already where physical distancing can't be guaranteed, we're moving to a mandatory face covering so that we can provide the secondary step, as it were, that the public health people have told us all the way along was necessary in the event you couldn't guarantee physical distancing. So obviously every effort will be made to make sure people can be physically distanced, but as you get more and more people using the system, and Mr. Leary might make reference to the specific levels at which you start to see a challenge with that, then the masks become the next thing we can do beyond all the disinfection and so forth.
Yeah, at the last month's board, we made it very clear, and it was very straight with the fact that we have difficulties with physical distancing when it comes onto buses. And we established guidelines for the number of individuals that we could have on buses, But at the same time, we wanted to make people aware. That's why when we started really making that push about the importance of face coverings. We're also in this report going to talk about the fact that we know that ridership's going to increase, and very shortly we will be back with 40–50% of our customers. And we have to look at how we're going to operate at that point in time. There are routes today, like Jane Street, for instance, where we have more buses on Jane Street today than we had pre-COVID. So we're really focused on doing everything possible, all right, to minimize the number of individuals on a bus, but we also know that as the ridership comes back, those pressures are going to be greater.
Okay, Julianne, we'll try again. You're up.
Can I just before we do add to that one thing? Mr. Leary has had and will continue to have my full support on making sure we allocate as best one possibly can buses to those routes where we see levels of traffic rising more quickly. And in fact, in many of those buses, they've maintained high levels of traffic during the pandemic as people have had to go to work. And so I have been fully supportive, notwithstanding that we only have so many buses to go around, but I think it is really important that we make our best effort to make sure that those buses are no more crowded than, when I say is necessary, then is produced by the fact that there's a limit on the number of buses we have. But that's been something very important in all of our discussions, and he's been terrific during this period of time leading up to now at making sure that those places had extra service so that we could make sure we kept people as safe as they could possibly be. And that will be the continuing desire of the city as the one of the major funders of the TTC and its ultimately its parent going forward.
Okay, Julianne, go ahead. Julianne, can you hear us? Okay, we'll move on to Michelle from the Canadian Press. Michelle, go ahead.
Question about, hi, Mayor Tory, thanks for taking the question. A question about collaboration or at least conversations with other transit providers that may be funneling passengers into Toronto. I'm thinking specifically of Metrolinx. As GO Transit traffic is likely to spike up as well. Has there been any kind of discussion with outside transit agencies in the bid to sort of harmonize policies and make sure that everyone's on the same page?
I'll take that. Yes, we're in close contact with all of our peers and all the transit systems around the GTHA, as well as Vancouver, Calgary, Edmonton, Montreal as well. We talk on a regular basis. And what you're seeing from some of the recent announcements of them is July 2nd seems to be the date that we're going to go back to making opening front doors of buses, start revenue collection again, as well as the concept of wearing masks and really working in that direction to get back to whatever the new normal is going to be.
Thank you. And my follow-up is for Mr. Leary as well, and it has to do with paratransit. To what degree is Wheel-Trans going to be included in the rollout of the whole thing? Obviously, the demographic using paratransit is most likely to require exemptions from the policy. Are they going to be, are there going to be specific policies rolled out along those lines? Is the mask distribution program going to include paratransit riders? To what degree are you integrating all this?
Oh, absolutely. Wheel-Trans is one of our family of services, as we call it, as one of the modes that it's very critical to this organization and our success. We, as well, are looking at how we're going to provide that service going back. Right now, we've taken every vehicle and people get a single ride. We know that about almost 90% of our service, we lost our service, the demand went down. So we're trying to build that back as well. And we have ACAT, our accessible committee, that gives us assistance as well with all the decisions we make there. But they're linked in with everything. Masks and all the communications are with them as well.
Okay, Julianne, we'll try one more time. Go ahead. Julianne? Okay, sorry, it did not work. If you have any further questions, you can just email us. That's it for today. Thank you.
Thank you all very much.